At Plymouth First Responder Center here today with a number of our chiefs from our advisory councils to talk a little bit about how they're doing with health and wellness and leadership current pandemic. Today we have with us Johnson from Loudoun County Fire Rescue, Chief Tammy Snow from Wichita, Kansas, and Chief John Oates from East Hartford. Thanks again for taking time out of your day to join us, and good to hear you guys are all doing well. So we'll kind of jump right into it. Chief Johnson, we've talked about how this is obviously a marathon. It's not a sprint. Some parts of the country have been dealing with this for 6 weeks now, most everybody a month. What are some of the strategies you've implemented there in Loudoun to help shore everyone from firefighters, frontline supervisors up to senior leadership, recognize and prepare that it's a marathon?
Ed, I think the most important thing that we've done is, which we try to do every time, is clear, concise, and consistent information. And normally, the way we do business in the fire service is that we have a number of folks that send out documents, whether that's general orders, informational bulletins, training bulletins, whatever it may be, and that stuff goes through a review process. With the implementation of COVID-19, certainly none of us have really ever dealt with a pandemic of this magnitude. So we're all in this together. And early on, I instituted the one voice, one message communication method. So basically everything to do with COVID and the rules and what we're asking people to follow directions are coming out of my office. Doesn't mean that I'm typing it all, but basically I'm assembling it all and then and editing it as a group and sending it out to our folks. The last thing I wanted to see was inconsistent communication, because it really takes all of us to deal with this and put our heads together, and the information we know is changing daily and sometimes hourly. So we get together, our folks get together. We have a COVID planning group, a select group of people that we get together weekly. Of course, daily we're having conference calls and information gathering, but an official meeting weekly to review the strategies for communication. But all that comes out of my office, and that was to eliminate or confusing statements or people having different opinions and different ideas sending out. So the folks get one consistent message from the System Fire Chief's office, and that is. We instituted a system liaison position that we brought up folks out of the field, detail them up, and their sole job is to keep track of our folks that are quarantined or isolated or positive, and then interacting with them and checking in on them daily to help calm their fears about working with us. Obviously there's administrative requirements, there's requirements for quarantining and isolating and navigating through the workman's comp process and all of that. So that really, the one message, one voice has really helped us to gain consistency and help really. I've had a lot of feedback that was well received, that they're not getting conflicting messages.
Obviously right now with a lot of firefighters, we're seeing across the country, obviously more so than ever, the concern of bringing something home to their families. And we're hearing it, from a lot of firefighters that they're worried about bringing home. So what are some things out there in Kansas to help alleviate firefighters' fears as it relates to that?
And one of the things that we did early on, which is probably, which may be a little bit different, is we initiated or implemented or instituted our Department of Operations Center, and we actually staffed it full time in the very beginning. So we've had an opportunity then to gather lots of information in regards to what some of our partners have done, our other fire science or our other fire service partners have done throughout the country. There's no sense in reinventing the wheel. Chief Johnson is exactly correct. These are unprecedented times. We're dealing with uncharted waters. Usually in the past, whenever you have this magnitude, you can always rely on help it's localized. You can rely from help from other entities. Well, in this case, you're not going to get any help, so it's basically on you. Some of the strategies that we've done is by utilizing that Department of Operations Center, we do exchange business. In the past, we have these training sessions in which we bring to virtual. type of messaging. And I concur with Chief Johnson in regards to communication. It's huge. You know, it changes before you can even hit the send button on your computer. And that we've done interactive, we've used telecommunication, and we do interactive. I have daily meetings with leadership within the organization, and then we also provide daily briefings, interactive daily briefings with our entire staff. So, you know, I'm informed. By implementing and instituting our Department of Operations, I've actually engaged the boots on the street. And so as they're becoming engaged, they're becoming informed. And all of us know that, you know, telegram, telephone, tell a fireman. If I can get a fireman to have a message, you know, they're going to market that a lot better than just it coming from me. So we've done those kinds of things. Them being part of it, they've thought of things, you know, they've been very resourceful. They've been very forecasting as far as getting things set up for us. You know, we've identified a facility that will take care of isolation for us. We've identified a facility that will take care of quarantine for us. Partnered with some of the other city entities and public safety entities, and we've got decon processes in place. Them just knowing that those things are concrete and already been established, I can't say that it is, it's reduced their stress. One of the things that we're currently dealing with is the latest information that the testing is becoming more available within the state of Kansas, and that our partners on those 2 states beside us have, you know, their numbers have tripled since they've had the testing. We're supposed to be getting the testing shortly, which means, you know, it heightens our anxiety. So this weekend, starting today, we'll start stressing the messages of the continued COVID best practices.
Hey, John, you know, we've talked a little bit about, you know, Chief Johnson talked about this marathon, but what are some long-term health and wellness consequences, particularly on the behavioral health side, that you anticipate for employees, and what are some things that you're setting up there in East Hartford to help work through that?
So I think there's a variety of things that have shown up. So let's talk about, you know, some of the recommended things relative to social distancing and stay home and to stay well. So all valuable messages, all things that we have to do, but so our workforce has to come to work. So we come to work, but now we've limited our contact. People are social beings. They wanna be able to have conversations with people. We've even noticed at the command staff level not being able to sit down around the conference table and have lunch like we normally do to exchange ideas. You can't do that anymore. So you lose that exchange of ideas and you lose that socialization. And now we tell people that when they go home, they have to stay home. So now they're in it with a captive audience that perhaps is now challenged to, how do I homeschool my children? Because I didn't sign up to be a teacher. So now I'm having to school my children, and their vacation got canceled and their sports programs have got canceled. And maybe the other partner in the house is out of work. So we have these compounding stress things. Forget about work for a minute. Just in life in general, we have all these compounding stress things that are now going to show up at work. And then we come to work and like, I can't go to the gym and work out. I can't, you know, the going to shop for the meal looks completely different. So what does my nutrition look like? So we have to be really, really vigilant to change how we share that message. Our wellness group has been really good about sending out, you know, here's workouts that you can do in the station or by yourself. Here's behavioral health resources that are web-based that can give you access to things in the future. Here's some things that we can do through the virtual environment that maybe we wouldn't have done otherwise that now provide that opportunity. And I think part of it is that has to be an everyday, or at least, you know, once a week kind of thing. You can't go, well, we sent that, we took care of it, we checked that box, let's move on. As this evolves, I think you see certain things. And in our community, you know, the first time that dispatch said that they had positive answers to the pre-screen, that was a moment. The first positive patient in the community, that was a moment. The first time we quarantined a member, that was a moment. The first, the first COVID-related fatality in the community, or those little kind of benchmarks things as they happen, those are opportunities when the organization kind of went, all right, where are we? What are we doing? And to take a pause and go, okay, what's next? We've been fortunate that I think we're just a tick ahead of the curve, but it's really, really difficult to stay there. And I think we have to, both chiefs mentioned that, if you go back and look at stuff that you crafted, wrote, or did 3 weeks ago, you're going to be scratching your head going, what the heck was I thinking? Well, you were acting on best practice or best information that was available. You're right. We're thrashing through hundreds of pages of research and documentation in order to make a decision that gets executed, sent out to the members, and go, oh, by the way, that's only going to be good for about 3 days until the next wave of guidance comes along. And it's important, I think, up front to say that look, we're gonna work at ludicrous speed. We're gonna change things based on vetted, credible, academically research supported information, not not what cousin Bob posted on Facebook. This is going to be what doctors and physicians and PhD level people are saying. And that takes, because you ask, what are two things firefighters hate? They hate change and they hate the way it is. Well, guess what? We're doing both, and at a rate that is more rapid than anything that I've ever experienced in my entire career.
Keith, when you talked earlier about leadership, you have a unique organization and a combined system there, and you mentioned the volunteer leadership. How's this currently affecting volunteer staff, and have you seen a big drop off with those folks within your system?
So our numbers are down dramatically in people wanting to become volunteers. We learned that the other day, that our numbers are drastically almost dropped to nothing of people signing up. We have not seen a reduction in of volunteers staffing the system. However, we have placed a number of them on quarantine, so that they certainly have that. We have 26 members that are in quarantine now, 3 members that are positive, and 7 more waiting to be tested. And again, more than half of them, half of them are volunteers. So when you look at the threat of, we know this is a dangerous job. Everybody knows that, but there's been an increase. Well, if I get COVID and if I'm a positive, what's in it for me? Well, obviously they're entitled to workman's comp benefits, and we have the Volunteer Firefighters Insurance Fund that provides them some insurance, but it's not going to make them whole as far as their full-time job. We know that. So there's been a lot of concern about that. We have one of our positive members right now is in the hospital, has been admitted, and he's in pretty serious condition. He's a volunteer. He's a retired, but he's a volunteer in our community, one of our stations in our system, and he's in serious condition right now, and we hope that he's getting better every day. But I think they definitely realize that it's out there. But we offer the same benefits. There are differences between a career employee, the benefits that we get with health insurance and all that. We try and offer those things to our volunteers, but there is a difference in that, and I think they're starting to realize that now.
I think, Ed, too,
or John, sorry, certainly wish him a speedy recovery there, Chief Johnson. So, John?
I think to that point, we're going to see both the short-term impact and the long-term impact. The short-term impact is, our employer's going to start to say, look, we believe in supporting the community, but I need you to do your job at your full-time job. And I'm not sure I feel comfortable with you riding out in the ambulance or riding out in the engine company and potentially getting dirty and bringing that to my business. So that's one of the things that we've heard from a number of volunteer fire chiefs. And then similar to what Chief Johnson said, the long-term piece of, what is it going to do to recruiting and retention, which is hard enough already, that now we're going to add this, I could maybe get hurt, an orthopedic injury or, cardiac cancer, all of those things. And now we're going to add infectious disease to that, where yes, it always existed, but it was more of a theoretical. Now it's a real thing, and go, well, wait a minute, this is not what I signed up for. So I think it's going to have a significant damaging long-term impact on the volunteer fire service that is already struggling to meet their mission in many communities.
Right. Well, Chiefs, thanks so much for joining us today. I know you're all very busy. Hope you all stay safe and healthy, as well as your staff. And we look forward to talking to you soon.